Have you ever wondered if it's possible to safely make your penis bigger, or why your urine sometimes sprays in all directions? You're not alone. I'm Dr. Eva Danial, a urology and men's health expert, and today we're diving into some of the most common and often unspoken questions I get from men. This is part of my Ask Me Anything series, where I answer real questions from the community with real, science-backed answers. Let's get started with the first question. I'm 24, and I find myself getting stuck in my head during sex. I worry too much about staying hard, and that anxiety makes me lose my erection. I'm dating, but this keeps happening, and I don't want it to keep ruining things. First of all, thank you for asking this, because it's more common than you think. Psychogenic erectile dysfunction, erection problems caused by overthinking or anxiety, is extremely common in young men. Erections can fluctuate depending on stress levels, alcohol use, emotional connection, temperature, and more. The first time it happens, it's shocking. The second time, you start to dread it, and soon, it becomes a cycle of anxiety, tension, and performance pressure. Here's what often happens. You're so focused on not losing your erection that you disconnect from your body. You're no longer enjoying the moment. You're analyzing it. That mental overload shuts down the very thing you're trying to protect. Now, the good news is this can be reversed. First, if you're under 40 and experiencing frequent erectile difficulties, it's still worth seeing your primary care doctor or urologist. Even in younger men, around 87% of ED cases can be linked to an underlying medical issue like early cardiovascular disease. The arteries in the penis are smaller than those in the heart, so sometimes erection issues are the first sign that something deeper is going on. That said, for many young men, the root is psychological. Working with a therapist who specializes in sexual performance anxiety can be extremely helpful. There are also practical strategies. For example, if you're in a trusting relationship, try removing the pressure around penetration. Focus on touch, sensation, and intimacy without trying to perform. As confidence builds, reintroduce stimulation gradually. You can also speak with your doctor about trying a low-dose erection medication like tadalafil. These medications don't create arousal, but they can make it easier to maintain an erection while you rebuild confidence. Sometimes a short course of support like this helps break the cycle. Now, on to the next question, which comes up a lot. Are the men in the adult industry naturally that big? Or are they using enhancements, surgery, pills, or techniques? Great question. First off, it's important to remember the adult entertainment industry selects people who already have naturally larger anatomical features. On top of that, camera angles, lighting, and positioning can exaggerate size. The average erect penis length globally is about 5.4 inches. Roughly 99.7% of men fall under 7.2 inches. So if you're seeing extremes online, it's just that, an extreme. That said, some performers do use medical aids. For girth, some may receive dermal fillers. For length, traction devices used consistently can produce mild gains over time. Vacuum pumps are sometimes used before filming to enhance temporary engorgement. And yes, some may use medications like sildenafil or tadalafil, or even penile injections, to maintain long-lasting erections on camera. There are even men in the industry who've had penile implants, not for size, but to address erectile dysfunction. These implants allow the user to control when they get an erection and for how long. Again, this is not for enhancement, but for function. So while yes, some enhancement methods exist, what you see on screen is not an accurate or healthy comparison for real life. Real sex is intimate, imperfect, and not shot in 4K with a crew and lighting. Don't use it as a measuring stick for your size, your ability, or your worth. Now let's move on to the third question. Sometimes when I pee, my stream splits into two or goes off to the side. What's causing that? This is actually very common, and there are a few possible explanations. Think of your urethra like a hose. If the opening is clean and unobstructed, the stream flows in one direction. But if there's any kind of partial blockage, like a bit of dried semen, inflammation, or narrowing from the prostate, it can disrupt the stream and cause it to split or spray. For example, after ejaculation, some semen may still be present in the urethra, creating temporary resistance that can cause the stream to split for a few urinations afterward. This is normal. Other causes could be benign prostatic hyperplasia, an enlarged prostate, which can constrict the urethra, or a urethral stricture, which is a more rare narrowing in the urethral tube itself. If you're also noticing a weak stream, difficulty starting, straining to urinate, or stopping and starting mid-flow, it's definitely worth seeing a urologist. These symptoms may point to BPH or another treatable condition. In the meantime, you can try sitting to urinate. It's common in countries like Germany and may help manage stream direction more comfortably. So to sum up, losing your erection during sex is common and fixable. The adult industry is not real life, and size comparisons are misleading. A split stream usually has a harmless cause, but should still be checked if it's frequent or disruptive. And if you want to support your prostate with our science-backed supplement combining saw palmetto, pygeum, green tea, cat's claw, raspberry, and soursop, this powerful formula helps maintain urinary health, reduce inflammation, and boost immunity, all in one daily dose. You can find the link in the description to try it today. If you want to hear more questions like these answered, consider joining my premium membership, where I answer subscriber questions in exclusive monthly episodes. You'll also get early access to all episodes, transcripts, and ad-free content. Your health deserves clarity, not confusion or shame. And if this video helped you, please do two things. First, hit the like button and subscribe for more science-backed men's health advice. No fluff, no judgment. Second, share this video with someone who needs to hear it. And in the comments below, let me know, what's one healthy habit you're starting this week to support your health? Your health is your responsibility, and taking action is one of the most powerful things you can do. Remember, open conversations about men's health break down stigma and empower you to make informed decisions. Whether it's addressing performance anxiety, understanding what's normal versus what needs medical attention, or simply learning to take better care of your body, every step you take matters. Men's health isn't just about physical wellness. It's about mental clarity, emotional balance, and living with confidence. Don't let embarrassment keep you from getting the answers you deserve. Reach out to healthcare professionals when something doesn't feel right. Talk openly with trusted partners about your concerns, and prioritize your well-being just as much as you prioritize everything else in your life. Your body is designed to work for you, and with the right knowledge and support, you can overcome challenges and thrive. And as always, take care of yourself, because you are absolutely worth it.